Online learning does not have to be scary. And Madison College was there for me.
We have people that are dedicated to our students' online success.
We can help you with your technology.
Give us the college try for 7 days. No risk, no worries. Madison College.
Good afternoon. This is Robert Chappell, Executive Editor of Madison365, with your daily update for, December 7th? Does that sound right? I think it sounds right. Frustratingly difficult numbers to talk about today, just because the level of testing we're seeing is very, very low. It has been low. Expected it to be low around Thanksgiving, and that sort of weekend, Thursday, Friday, Saturday, that weekend. Today's testing numbers are actually even lower than that. We only saw 7,900 tests come through today. Of those, 2,155 were positive. So that's a daily percentage for today of 27%, which is very high, remains very high. It's not as bad as we've seen. It's higher than yesterday. Yesterday was 26th, but 2 days ago was 35. So, that's not terrible, in terms of the percentage. But with that small number of tests, it just doesn't give us a good full picture of really what's going on. So we're going to stick today. Okay, I'll tell you a couple other numbers. That lower testing also brings our positive test rate down a little bit for the 7 days. It is now 30.7. It was 31.1 yesterday. So that's that's good. That's positive that's falling a little bit again. I'd like to see that coming down even further. But again, that's kind of, it's not as dependent on testing as the raw number of cases is. But that I still don't really trust that as a fully accurate depiction of what's really happening, just because of that low prevalence of testing. That's by the way, the people. In the past 7 days, 30.7% of people who've been tested have tested positive. In terms of tests, this is actually a much better number. It actually dropped a lot. It's 12.8 now. It was 13.5 yesterday. So 12.8% of all tests that have been run in the past 7 days were positive. That's still really high. That's like 4 times as high as it should be. But it's, for that to drop from, almost a full percentage point from yesterday is very good, very positive. Now let's talk about some other numbers that we don't like so much. Our total death toll now is 3,738. That's 19 more than yesterday. We've typically in the last month or so seen fewer deaths reported on Mondays. Not because fewer people die on Mondays, but because it takes a week or more for a COVID fatality to make it into the state, to be reported in the state data. Because there's a whole bunch of steps that have to take place for that to be certified and confirmed and all that. And just that process doesn't happen as much on the weekends, right? So the past couple of Mondays, the death counts have been like 6. So to be 19 today is a bit on the high side. It also takes our 7-day average over 60 for the first time, because, like I said, last Monday was only 6. So you're looking at 7 days. That number 6 falls off, and you replace it with a 19, so everything goes up. But over the past 7 days, here's their death counts for the past 7 days. 19 today, 17 on Sunday, 77 on Saturday, which is high, 63 on Friday, 60 on Thursday, 82 on Wednesday, and 107 on Tuesday. That's a lot. That's a lot of fatalities. And we're now over 60 for the 7 days. I would anticipate, just looking at the patterns and the ratios that we normally see between new cases 3 or 4 weeks ago versus death toll today, cross our fingers. We hope that tomorrow's death number is not that high. I anticipate another day over 100 deaths tomorrow. I will be very pleased if I'm wrong. But that's my anticipation. That's what I would expect to see. It'll be our third consecutive Tuesday over 100. And as a result, then, the 7-day average will probably either stay very steady around 60 or go up a little bit. If you have any questions or comments about any of this, feel free to drop them in the comments. I'm watching those. Hospitalizations is another effect of, the lagging indicators. Like you get a certain number of cases one day and then hospitalizations go up or down a couple of weeks later. Hospitalizations have been on a steady and kind of steep downward trend over the past couple of weeks, right? There's 1 or 2 days where they go up a little bit, but they've been going down. Today they went up, and kind of by a lot. So what we've been seeing is they've been going down by like anywhere between 30 and like 90 per day. We're talking about the total number of people currently hospitalized. It got up as high as like 2,200 at one point. As of yesterday, it was down to 1,502. So it was, about a third off from its high point. Does that make sense? So like we got to about 2,200, and now we're at 1,500, which is about 2/3 of that, of 2,200. So it had gone down considerably, which we hope eases the burden on the healthcare system. And then it went up by like 10 or 12, and then continued going back down. So it's a general downward trend, even though 1 or 2 days it would go up by a little bit. Today it went up 64, which I don't like. It is now 1,566. That's kind of a lot in one day if we look at the pattern of the past 2 weeks. So, we'll keep an eye on that. I would hope that might be just a one-day blip, and it might start to go back down. Now, in terms of why it's going down, there's some speculation about that, and it might be that, beds, in terms of the space capacity, in terms of number of beds, number of rooms available, has been okay, but staff has not. Like, a lot of hospitals are in critical staff shortages. Last week, 34% of hospitals in Wisconsin reported a critical staff shortage. So it might be, this is the bad, there are two bad scenarios for this. Even though the downward trend of hospitalizations is good news generally, there's two possible reasons that could be very bad news. Number one is that many people are dying. That people aren't being discharged from the hospital, but they're rather dying in the hospital. That's not as likely. Just because if somebody dies in the hospital, it's going to be in the ER probably, right? Secondly, it could be just that hospital staff is so short, that they're so short-staffed, that they're just not able to admit people who should be admitted. And there are a whole bunch of people at home right now who should be hospitalized, but are not, because the hospital doesn't have the capacity for them. Now, I hope that's not the case. Now, I will say that the alternative care facility in Milwaukee, the field hospital at State Fair Park, has only 6 patients in it today. That's the same as yesterday. I mean, some hospitals are at that point where they're having to shift people away, but not very many people. So that's good news, right? But there are also a lot of hospitals that aren't near Milwaukee who might be just sending people home because they have to, or not admitting people because they can't. And there are some hospitals where people are sitting in the emergency room for a full day, for 24 hours. If a person is in the emergency room, but there's no beds for them and no room for them up in the main hospital, they're not counted as being admitted to the hospital. So if there are a lot of those people, then that wouldn't be reflected in this data, and this data could be continued to go down just because there's not enough capacity. So again, we like to see that number going down, but we just want to be realistic that it might be that this current sort of wave of infection isn't as severe, but it also could be that they're doing more at-home monitoring, and they're just really intentionally keeping the hospital population low because it is so difficult to monitor and to care for these patients. And I was told, by Dr. Ray, the CEO of Prevea Health, that one COVID patient takes as many resources as 2 or 3 regular patients. Right? So that's 64 new patients in the hospital. That's more like 120 to 180 people being admitted in one day. Or not being admitted, but an increase of 120 or 180 new patients across the state if there were any other kind of patients. Right? It's just so much more staff, time, and resources and energy have to go into caring for a COVID patient than any other patient. Okay, what else can I tell you today? Let's talk about where the deaths occurred today, the 19 fatalities that we had. Pretty well spread out. Similar to yesterday, where you have 5 in Marathon County. Yesterday we had 7 in Barron County. And then we had 3 in Waukesha County, 2 in Vilas County, and then 1 each in Waushara, Portage, Marinette, Lafayette, Kewaunee, Jefferson, Greene, Eau Claire, and Brown counties. Again, it's hard to say exactly much about the new cases just because testing is so low, so you don't want to say anything too definitive about this. But it looks like, as has been the case, the top 13 counties in terms of new cases per capita are all very rural counties. So you have Florence County only has 6 new cases today. But that's equivalent to like 100 new cases in Milwaukee County, right? It's 141 new cases per 100,000 residents. No. I did my math very wrong there. 6 new cases in Florence County is basically equivalent to about 900 cases in Milwaukee County. Right? Just because Florence County is so sparsely populated. So Florence County leads the way today in terms of new cases per capita, per 100,000 residents, 141. After that is Douglas County, and then Iron, Price, Washburn, Taylor, Marinette, Dodge, Forest, Jefferson, Iowa, Marathon, which Marathon you could argue has at least one pretty good sized city in Wausau, but then Polk and then Waukesha. Waukesha is the first county in that list that is truly an urban county. Waukesha County has 231 new cases today, and that's only 56 or 57, I guess 57 new cases per 100,000 residents, right? So again, that's why we're doing it this way, to kind of compare apples to apples in terms of new cases per 100,000 residents. And it is the fastest spread, or the most spread, is still in those rural counties. Okay, I think that's all I have for coronavirus. I want to mention a couple other stories that we've been reporting on today. If you're in Madison, it is going to be a kind of wild couple of months in terms of local elections. There are 5 out of the 20 city council members have decided not to run for re-election. It's a little disappointing that incumbents are very rarely challenged in Madison, and I guess anywhere, really. Local election incumbents just usually aren't challenged. But 5 have announced that they're stepping aside. And there are a lot of people of color already jumping in to run for those seats. So we're going to do our very best to profile all those candidates, just to be fair, to help people get to know who is seeking to represent them on that city council. Today, our first one is for District 8. Juliana Bennett is one of 2 black women running for that seat. It's a student seat, really. It's not officially a student seat, but the district represents the University of Wisconsin campus. So for the past, 20 years probably, it's been primarily represented by a student, which is kind of cool. But Max Prestigiacomo was appointed to that seat when the previous incumbent couldn't finish the term, and has decided to step aside, saying that, I'm a white guy, we don't need another white guy in leadership around here, so he's going to step aside. So Juliana spoke with our reporter, Emily Wolf. We have a profile of her and what the issue she's running on the site right now, Madison365.org. Aomi, another Aomi, is going to run for that seat also, and I'm sorry that I don't want to. I hate mispronouncing names. Aomi Abusa is also running for that seat, and we're going to have a profile of her very soon. We're like arranging to do the interview and stuff. But also, there's another seat, Paul Skidmore, who is a very much pro, police type person, and very opposed to any sort of police reform, and therefore kind of out of step with a lot of sort of the zeitgeist right now. So he has actually 3 people running against him. Remember I mentioned that they don't challenge incumbents very often? Well, he's got 3 people running against him. So we're going to be following that race as well as all these other races. So it's going to be kind of a wild thing. Plus, the president of the school board stepped down. We haven't seen anybody jump up yet to run for that seat, but that'll be a pretty contentious election, I would imagine. So it should be fun for local politics. Then the other story we have this morning is 2 UW-Platteville alumni, which is my alma mater. Go Pioneers. 2 UW-Platteville undergrad alumni have returned to campus as instructors. It's the first time in like 10 years that a black alumnus has come back to teach at Platteville. And there's 2 of them this semester, just starting the semester. Jeremy Payne and Sakara Wages. Both of them are still working on their PhDs. So they're like adjunct instructors right now. They're not really full professors yet, because you got to have a PhD for that. But they're both going to get there. So they're both teaching ethnic studies and race and gender kind of studies, which is very exciting. I took the race and gender class there. It's sort of a freshman requirement. You have to take the race and gender class. This is going back quite a ways, as you can tell by my beard. But it was a white guy teaching it, which is kind of silly. So it's cool that Jeremy Payne is now teaching that class, and Sakara Wages is teaching some other ethnic studies courses. So that was a nice story. We have the Fatima Sise wrote for us. That's on the website right now. Also, one last thing I'll mention on the website today. You should listen to Black Oxygen today. It is an interview. It's our weekly program with Angela Russell interviewing black folks around Wisconsin about what it's like to live here as a black person. And if you're black, you will identify with it. If you're not black, you should listen to it just to learn. Just to learn what everybody's talking about and what it is to live here in Wisconsin as a black person. But the guest today was Gabe Doyle. He is the younger son of former Governor Jim Doyle. And he is biracial and he's adopted. And his brother Gus is black and adopted also. And he talks a lot about growing up in Wisconsin, first of all, as a black person, but also growing up in a white-ish family, growing up in this sort of in-between place between, like, he's lighter-skinned, but it still identifies as black and has 2 white parents who, are taking him to Ben's barbershop in Madison. And his dad he's a little kid, his dad's running for attorney general, so they're traveling all over the state. It's a really fascinating conversation about just growing up that way, about how he thinks of things, about working in Project Umija as a social worker and a counselor in Milwaukee, where he's dealing with like violence every day and like counseling kids who are in the middle of trauma and violence and the sort of vicarious trauma that he experienced. Really, really fascinating conversation. It was an hour-long interview, and it felt like 15 minutes listening to it today. Really fascinating stuff. I definitely commend that to you. There's a link on the website to listen to on Spotify, or you can just go to Spotify, Stitcher, Apple Podcasts, wherever you get podcasts, and search for Black Oxygen. Listen to today's episode. You will not be sorry that you did. Okay, last thing I will say before I sign off here, we are still for a couple more weeks in this news match program, meaning we're a nonprofit newsroom. You know that. We exist to provide you with all the information you need on the news, all the high-quality, local, independent journalism, and never charge you for it. So that means we need donations from those who can afford it to keep going, to keep growing, and to keep providing this daily update, to keep providing the news every day. And this news match thing is super, super simple, and it's like no questions asked, no strings attached. We get donations from you between now and the end of the year. We send the Institute for Nonprofit News a spreadsheet on the 1st of January. We said, here's all the donations we got. They add them up, and they write us a check for that amount. That's it. That's all there is to it. You give us $50, they give us $50. You give us $100, they give us $100. We double. Your donation right now goes twice as far as it would any other time of the year. So if you've been thinking about it, you think about this is an important thing that I just look at every day. I watch this update every day. I listen to the podcast every day. I read the news. I follow you on Facebook. If Madison365 has spoken to you in some way, and you have $10 to spare, or 20, or 50, or 100, think about right now. Go to Madison365.org/donate. Super simple. 3 or 4 clicks, you're done. And whatever you give us, we get that same amount from these other folks. So that's all there is to it. Thank you for your attention today. I'll be back tomorrow with another edition of the Madison365 Daily Update. Have a great evening.
This is 365 Media.